Hi everyone, this video is to demonstrate the use of nasal naloxone here at Salem Hospital.
Naloxone, or narcan, is an opiate antagonist that can be used to counter the effects of an opiate overdose. It works by displacing the opiates from the receptors in the brain that control the central nervous system and respiratory system. Examples of opiates are fentanyl, Demerol, morphine, oxycodone, hydrocodone, codeine, and heroin.
So how do you know if an individual is suffering from an overdose of opiates? This is a list of common signs and symptoms. However, there may be other signs and symptoms you may find. But your individual may be somnolent or obtunded, have shallow breathing. They could have snoring respirations, which is a result of a partial obstruction of airway. Therefore, you must open the airway and possibly provide rescue breaths. If you find the individual to be agonally breathing, that is a sign of a respiratory arrest, so CPR must be initiated and the code blue team should be activated immediately. The individual may have blue or grayish lips, fingernails, or skin. Their skin can be clammy or sweaty. They may be bradycardic and have pinpoint pupils. You may find drug paraphernalia in the area of the individual who is suffering from the overdose. The individual may have recent track marks on their arms or legs, have a history of recent drug use, or also a recent period of being sober. Hence, their tolerance to the opiates is decreased, putting them at a greater risk of suffering from an overdose. Naloxone can be given IV, IM, or intranasally. IV or IM naloxone, the initial dose is 0.4 milligrams to 2 milligrams and may be repeated every 2 to 3 minutes until desired effect. Intranasally, naloxone dosage is 2 to 4 milligrams and may be repeated every 3 to 5 minutes until desired effect. Here at Salem Hospital, we now have nasal naloxone rescue kits stocked in every Omnicell. Each kit contains a 2 milligram per 2 ml syringe of naloxone and 1 atomizer, as shown in the pictures above. If you find an individual experiencing an overdose of opiates, the first thing you must do is check for responsiveness. Next, you want to check for a pulse and for breathing. If they are not breathing and do not have a pulse, begin CPR and activate the code blue team. If they are breathing and have a pulse, call for help and activate the critical response team. Ask a coworker to retrieve the nasal Narcan rescue kit from a nearby Omnicell and quickly administer 1 dose into the individual's nostrils. Then stay with the individual until the team arrives so that you can communicate to the team any treatment rendered and how you found the individual. Next, you're going to watch a video of a nurse finding her patient experiencing an overdose of opiates and having to administer nasal naloxone. Hi, Mr. Jones, are you okay? Your oxygen's a little low. Maybe you need some more oxygen. Mr. Jones? Mr. Jones, can you hear me? Mr. Jones? I need some help in here. Please call the critical response team. Now we're going to show you how to put together a nasal naloxone rescue kit. First, remove the contents from the box. Inside, you will find a syringe of naloxone and a nasal atomizer. Remove the cap from the syringe of the naloxone and apply the atomizer. Now you are ready to administer. When you press the plunger, a fine mist will eject from the syringe. As you can see, the nurse turned the patient into the recovery position after administering nasal naloxone and is waiting for the team's arrival. If you have any further questions on this, please refer to the elucid policy on nasal naloxone administration or ask any of the clinical educators. Thank you for watching this video.